I'm Tesla, and today I'll be reconstituting an IV medication and delivering it via mini bag infusion. So first thing I'm going to do is my hand hygiene. A little extra there. And I've already checked my MAR to my physician's order and everything is accurate, so I'm just going to check my MAR to the medication that I've chosen. So my patient today is Emma Wrightson, and I'll confirm that at the bedside. The medication she's getting today is cloxacillin, and cloxacillin is what I've grabbed here from the med cart. Her dose is 1 gram, and I have a 2 gram vial, so I know I can get my dose from that. The route is IV, and this vial says it can be given IV only. And the time and frequency is every 6 hours. Her last dose was at 600, and it's now 1200, so she's due for her dose. And she also has an allergy to shellfish, and I'll confirm that at the bedside. So now that that's done, I'm just going to check my parental drug monograph for cloxacillin. It's an antibiotic. She's getting this medication for her pneumonia. It says that a student nurse can give it, so I'm okay to give it. The usual dosage is between 1 to 2 grams, and her dose is 1 gram, so it's safe. The maximum single dose is 2 grams, and the maximum daily dose is 12 grams, so my dose is under that. And to reconstitute this medication, for a 2 gram vial, I have to reconstitute with 6.8 mLs of sterile water for injection. So that's what I'll be doing right now. I have my medication and my sterile water. I've checked both to make sure that they're not expired and they're intact, so I'm okay to use them. Okay. I'm going to take the metal cap off and swab the top for 30 seconds, and we'll say it's been 30 seconds, and I'll let that dry for 15. Take a new swab and swab my water for 30 seconds and let it dry for 15. So I need my 6.8 mLs. I've got a 10 ml syringe. I'm going to open it by winging it back to maintain sterility. Now I'll just put my garbage here. I'm going to take my blunt fill needle, open it by winging it back to maintain sterility, and connect the two like so. Make sure that's on. I'm going to draw back my 6.8 mLs of air and inject that into my sterile water. And just let the air pressure fill my vial, my syringe. Making sure I get rid of all the air bubbles.
And make sure not to cover that.
Get my right dose here. Okay. So my 6.8, I don't know if you can see that.
Hi, my name is Dennis.
And I'll just put that right into my med vial. It's still clean from alcohol swabbing. And
I've already compared my MAR.
And I'll let some of the air pressure come back out into my syringe.
Went to the Pixis to grab my medication. So I'm just going to...
And I'll recap using the scoop method to maintain sterility and not poke myself. I'll reconstitute my medication by rolling it, because if you shake it, it can introduce air bubbles in your medication, and we don't want that. While that's reconstituting, I'll just tell you the math that I've done. So to get my dose from my 2 gram vial, I've calculated that my final concentration, according to my parental drug monograph, is 250 milligrams per ml. And to get my dose of 1 gram, I've calculated that I need 4 mLs.
Every 4 hours.
So that's what I'll be drawing up.
11, and it's close to 11.
I'm just going to swab my medication vial once more, because I'm not sure if I may have touched it during reconstitution for 30 seconds and let it dry for 15.
Any allergies? No known allergies?
So I'll draw back my 4 mLs of air in my syringe.
I'm going to look at my monograph. So hydrocortisone, it's a corticosteroid. It is given by a student nurse. Usual dose is 100 to 500 milligrams every 2 to 6 hours, so it's in the range. It's a 250 milligram vial, so I have to give 1.8 milliliters of water for injection. So the final volume will be 2 mils. The final concentration will be 125 milligrams per milliliters, which means I need
Shut up a little.
withdraw 1.2 milliliters
4 mLs.
drug after reconstituting.
So now I'm going to do my second check,
I'm going to check the second page.
comparing my med vial, my MAR, and my syringe. So my patient is Emma Wrightson. I'll confirm that at the bedside. My medication is cloxacillin, and cloxacillin is what I have drawn up. My dose is 1 gram, and I've calculated that for 1 gram I need my 4 mLs, and that's what I have here. My route is IV, and this can be given IV, and then time and frequency is every 6 hours, and we know that she's due for a dose now because her last dose was at 600 and it's now 1200. So according to my parental drug monograph, I have to dilute this medication in 250 mLs of D5W or normal saline.
So I'm gonna swab
My
you
my patient is currently getting D5W, so I know that that's compatible, but I'm choosing to do normal saline because she has been experiencing some diarrhea, so I'd rather just replenish some of those electrolytes and fluids that she's lost through normal saline. So I've chosen a normal saline bag, 250 mLs. It is not expired, the color is good, the bag's intact, so I'm going to use this bag. And I'm going to swab my medication port for 30 seconds. Let it dry for 15.
You need to start over. You need 10.
Okay, 30 seconds.
You need another syringe, 10 ml syringe.
When I inject this, I'm making sure I'm not puncturing my bag with my needle.
A small bag of normal saline. For the
Okay, and I'll put this right into the sharps. And I'll just slowly turn in my hand to mix the med and the solution. And I've already made my med label, but I'll just tell you what's on it. So my patient is Emma Wrightson. My drug name is cloxacillin. My dose is 1 gram, and now it's diluted in 254 mLs. So my final concentration in this bag is 3.9 milligrams per milliliter. She's getting it IV and at noon. So I'm just going to put that on my bag. And I'm going to grab some alcohol swabs, my tubing, my MAR, and I think I'm ready to go to the bedside. So I'm going to enter my patient's room, do my entrance safety check, make sure there's nothing in the environment that could harm my patient. I'm noting their tubes that they have, making sure the IV, the primary line is running. I'm noting if the patient is in any distress and she's okay.
How was that?
So I'm going to do some hand hygiene now, and I'm going to introduce myself. Hi Emma, my name is Tesla. I'm going to be your student nurse today, and I'm just here to give you your IV medication. But first I'm just going to take a look at your wristband here. So I'm comparing my MAR to my patient's wristband. So Emma Wrightson. So can you tell me your name and your birth date? Name and birth date, it matches up with my MAR. And do you have any allergies that I should know about? Shellfish, okay, great. So I'm just gonna finish my third check while I have that started, comparing my bag, my label, and my MAR. So Emma Wrightson, we just confirmed that's our patient. My medication is cloxacillin. Cloxacillin is what I have here. 1 gram. 1 gram is what I have diluted in 254 mLs. IV is the route, and time and frequency is every 6 hours. And we know that she's due for her 1200 dose now. So my third check is done. So Emma, I'm just going to teach you a little bit about your medication. It is your cloxacillin. It's an antibiotic that you're receiving for your pneumonia. So some side effects you might experience from this medication are nausea, vomiting, diarrhea, and maybe a little irritation at the IV site. So you just let me know if you experience any of those, and I'll help you as best as I can. Also, when I was checking her name band, I was assessing the IV site for signs of redness, swelling. I asked if she experienced any pain or discomfort there, and she doesn't. So. And I've also noted that my primary line is infusing well, so the line is patent, and I'm okay to give her a medication. And also noting she has the right to refuse the medication if she wishes, but she doesn't want to because she wants to get better. So I'm going to go ahead and give her medication. So I'm going to take this hook out right away. I'm going to lower my primary bag.
1.2 milliliters of the drug. So since I'm doing it through a SIVA pump, I'm just going to quickly look at the SIVA chart.
I'm going to open my tubing and just close it. It's already closed.
Use a 10
and I'm going to spike my bag.
Volume 10 milliliters. So I will be withdrawing
maintaining sterility
8.8 milliliters
of my tips.
with my 1.2 milliliters
Like my
of
bag.
hydrocortisone.
And my clamp is
First,
closed, so I'm just gonna turn this upside down
Do hand hygiene.
and hang it there for now. And this is okay to hang because the cap is still on. And I'm going to swab the port above my pump because I want my secondary infusion to be regulated by the
30
Baxter pump.
seconds and then
So
15 seconds.
I'm going to
Video
choose
save, I'm
this
gonna
port
press forward.
right here and swab it for 30 seconds. I'm going to dry for 15,
So the other one,
making sure that I don't touch it after I've cleaned it.
just keep it sterile, don't touch it.
And I'm going
So
to
now I'm gonna grab my
connect
and my syringe.
my tubings. Okay. So now I'm going to back prime my tubing, making sure that my roller clamp is open, and slowly lowering my tubing to get the air bubbles out of my
Now I'm
secondary
gonna
tubing.
pull out 1.8 milliliters.
Okay, so there goes the last one. This bag came a little full, so I'm just gonna tip it over because we want our drip chamber to be 1/3 to 1/2 full, and there's 1/2. I'm just gonna close this again for now, and I'll hang it back up. So now there's no bubbles in my tubing.
Milliliters.
I'm going to program my secondary now. So press secondary. My rate, according to my parental drug monograph, I can give it over 30 to 60 minutes, and I've chosen to give it over 60 just because she doesn't have any other IV meds today, and it's a larger volume, so she might tolerate that better. So my rate is 254 milliliters
Now I'm gonna inject this into my hydrocortisone
per
I
hour.
haven't touched it, so it's still
My volume is
sterile.
254. I'm going to confirm secondary, and then start. Make sure my clamps are open,
Everything else is just fine.
and I'll watch for 3 drops. So there's 1,
Okay, I'm gonna
2, 3. So it's running. I'm just gonna
slowly
stay
so it doesn't
and watch
foam
if there's
up.
any immediate adverse reactions to the medication. Make sure that's running well, and I'll make sure that I document that my patient got the medication at the time that it was supposed to be given, and I'll ask my patient if there's anything that they need, and I almost forgot, label my tubing so that other nurses know when this tubing was used, when it first started. And I'll tell my patient that I'll be back in about an hour or so, and I'm going to assess the site, assess how my patient's doing to make sure that the medication is having its therapeutic effect. And I'll make sure that my primary line is running again after that. And when I leave, I'll make sure my patient has their call bell and they're not in any distress. Thank you.